Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. Before I get started, you might notice that I just took my mask off, but I've got to remind you, this mask can save your lives. So make sure you get these masks on and make sure it covers your nose and your mouth. Good morning, Dr. Friedland. We appreciate you being here. We're going to be talking about the diagnosis, management, and treatment of hearing and vestibular, otherwise known as balance disorders. So welcome. We appreciate you being here.
Thank you, Dr. Lippman. I brought with me today one of my faculty, Dr. Kara Gottschalk. So she's here joining us also to talk about these things.
Oh, we're going to get to her in just a minute. I just wanted to let the people know that this was this is your show, as I always say, and I've been saying it for 21 plus years. So we get a lot of questions relative to your own care, because I always tell you to take good care of yourself. And one of the things that seems to be sort of a mystery, because all they see is advertisements in newspapers and television about hearing aids and hearing issues, but these are the experts. Our program and the Department of Audiology is probably one of the most preeminent programs, not in the United States, but in the world. And Dr. Friedland is the chair and associate professor of the Department of Audiology, and I thought that who better to bring on but her and Dr. Gottschalk, who is an assistant professor. So let me introduce Dr. Kara Gottschalk, assistant professor, the Department of Audiology at the Pallavi Patel College of Healthcare Sciences. Good morning, doctor.
Good morning.
I understand we have congratulations. I understand you just attained your Ph.D. as well.
I did. Thank you.
Congratulations. Dr. Friedland, talk to us, because you've been part of this audiology program for quite a while. I would never say for a long period of time, but quite a while. Talk to us about the Department of Audiology at the College of Healthcare Sciences.
Sure, I'd be happy to. So you can say it. It's okay. It's been 23 years. A really long time. So the Department of Audiology is the home for several programs, training audiologists and training audiologist assistants. And then we also have a full service community audiology clinic here on the Nova Southeastern University campus. It's in the Ziff Healthcare Center building on the corner of University Drive and 30th Street. And we've been there for about 10 years now, 8 to 10 years now. We were down the street before, but this community clinic's been in operation for close to 25 years now. It's a full service clinic, seeing newborns to your oldest geriatric patient. I think currently our oldest patient is 102. And we do everything from diagnostic evaluations to hearing aid evaluations to treatment with hearing aid fittings. We have a full vestibular clinic evaluating people that have dizziness, vertigo, balance issues. And we have a very robust clinic for auditory processing, which is what you do with what you hear.
Dr. Friedland, obviously we want to talk about the hearing, in quotes, aid devices, but I wanted to touch on the vestibular issues, the balance issues at first, because some of our viewers have brought to us issues relative to this balance question, and knowing that you work collaboratively with your colleagues in our multiple programmatic clinical operations here at NSU at the ZIF clinic. How does one get referred to you for the issue of encouraging and deciding how to deal with the balance questions?
So we are partners with a number of physicians in the Broward County area, and also with our physicians that work here in the NSU health system. So any patient that's having balance issues, dizziness issues, vertigo issues can be referred to our clinic for a full vestibular evaluation. We do have some of the only equipment that's available in Broward County. We have something called a rotary chair. I believe there's only one other location in Broward County that has this device. And we have a full complement of other types of device for evaluating the vestibular and balance systems. You know, this is a little bit of a newer science to audiology. It's really come into its own, I guess, in the past probably 15 years. Part of that is with newer technology, we've discovered some newer ways to evaluate different parts of the vestibular and balance system. I think also, Dr. Lippman, I want to mention our interprofessional fall clinic, which takes place 2 to 3 times a semester and involves audiology, physical therapy, occupational therapy, optometry, pharmacy, I believe internal medicine also. I may have missed a few, I don't know, but they see patients that are having balance issues and are at risk for a fall, and they do a comprehensive interprofessional evaluation and then make recommendations about treatment that would be appropriate for the patient.
Yeah, just recently we had a note from one of our viewers relative to, actually it was an exemplary note thanking us for working out their balance issues, but they spoke about the cooperative and collaborative work between the Department of Audiology, the Occupational Therapy Department, and the Physical Therapy Department. I think that people don't really recognize the relationship, and I know you just mentioned it, but maybe we could just elaborate a bit upon that.
Sure. I think I'm going to let Dr. Gottschalk answer that question. She does a little bit more vestibular work than I do.
Okay, Dr. Gottschalk?
With the vestibular system or the balance system, it is a system that takes input from not only your body and also your eyes, as well as the system itself. So when we look at the balance system, we really do have to be on multidisciplinary team, because we have to figure out where exactly is the issue. Is it in our balance system? Is it due to issues in our eyes, or is it due to issues in our body? So to really understand what's causing symptoms in each individual, we have to look at a whole bunch of systems in the body to figure this out.
I think that's how occupational therapy and physical therapy comes into play with those two, along with audiology, because the body part that Dr. Gottschalk mentioned has to do with, how your feet are basically feeling the floor, how your arms and legs are moving relative to how your head is moving. And those systems are really best evaluated through occupational therapy and physical therapy. And then one of the treatment methods that we recommend for patients that have vestibular issues, which is in the inner ear, or maybe balance issues, which is more central in your brain, is something called vestibular rehabilitation therapy. And that's most often completed with a physical therapist.
We get a lot of situations in the community and even around here at the university where someone is so-called trip and fall, but it's really, there's nothing to trip on. but they lose their balance, and they're taken off to a 911 call, and the immediacy is that, well, maybe there's a TIA, a little infarction in the head or otherwise, and yet, thank goodness, many of them don't turn out to be that way, but they are inherent to a balance problem that is caused by a lot of internal mechanisms, which you and Dr. Gottschalk will discuss. It really is very valuable to have a balance program here at your program of audiology to prevent a lot of, I would say, situational falls, and people would understand why this happens. Is that true?
That is true. Yes, Dr. Lippman. Our students here, and I would be remiss if I didn't mention them, they actually have more training in vestibular science than most other programs in the country. And they also have the option of doing a vestibular specialty course. So once they finish the first 2 courses and a lab, they can actually do a 3rd course, which gives them just that much more information with regards to vestibular science. And it talks about very special populations. And so then we need to practice that in our clinic. And so we implement all the things that we teach in the classroom in the clinic, because what better way to teach students than to have it right here available on campus? And so I think that the students obviously benefit from this, but then also the community benefits from all of these things. And we certainly try to ensure that we have the newest and most contemporary equipment for evaluation. There's many different parts to the balance system in the inner ear, and there's approximately 6 different tests we can do just to assess this tiny organ in your inner ear and really kind of zero in on exactly what's going wrong with that, if it is in fact in the inner ear. And then if not, it becomes something that we need to refer to perhaps a neurologist or to a physical and or occupational therapist.
Before when you talked about regional being Broward County, I can tell you just personally, I spoke to someone from Fort Myers recently, and I spoke to someone from the Jupiter area that travels down to your program. So we're rather regional, and to tell you the truth, relative to, and we're going to get to the audiology portion of it, the hearing portion of it very shortly, but this balance issue, the vestibular issue, has established a relationship well beyond the borders of not only South Florida, but really beyond the state of Florida, because there's a lot of inquiries relative to your techniques. So congratulations not only to your program, but to people like Dr. Gottschalk. Dr. Gottschalk, do you see that? Do you see people coming from afar?
Oh, definitely. We do see patients all the way on up from St. Lucie County, all the way on over. We get a lot of individuals from Monroe County as well. So, as Dr. Friedland stated, we're one of the few in the area who actually have the ability to do these tests. And so it does make it a lot simpler on the patients that they can just come to one place and get everything done to figure out what is causing their issues. And so not all dizziness can be treated the same. So by figuring out and talking with each patient, we can actually decide which tests they may need that better suits their symptoms.
Okay, now obviously the most known portion of an audiology program is hearing, with all due respect to the vestibular issues. Let's talk about that.
Sure. So hearing loss in children are actually one of the most common birth issues that they may be born with. So our goal, not just at NSU, but all throughout the field of audiology, is to try to get young children or infants in hearing aids as soon as possible. So we want to try at the very most to get them in hearing aids by the age of 6 months. And I may be biased, but I do think little babies in hearing aids are just the cutest things ever. But, a lot of adults that we see in here, they instantly assume that, they just have hearing loss because they are packing some more birthdays under their belts. And that's not it at all, because we see hearing loss occur throughout the life course and lifespan. We are seeing a lot of teenagers with hearing loss now. And that's because of the lovely technology known as iPads and earphones. So we're seeing more and more teenagers come into our office with what we call noise-induced hearing loss, because they're listening to music much louder than what they need to. So I think everyone makes the assumption that we're just here for adults, but we see people throughout the lifespan.
The amount of harm that's done by oversimplistic things like, grass blowers or to music, extreme sounds, the large venues, sports venues, and things of that nature. Now, we're not saying that you should avoid them, but there's some way to mitigate some of that. And particularly children, as I understand, have a tremendous loss of hearing capacity because their ears are not protected. So help me out.
We live in a noisy world, that's for sure. Lots of the studies that are out there on urban versus rural populations definitely show that those that live in a more rural and quieter lifestyle have less damage to their hearing over time. But since we're not all moving to those kinds of places, we do need to take care. As you said, things like blowing leaves or mowing your lawn or edging your lawn, those are loud pieces of equipment, and you should be wearing hearing protection, either the kind of protection that you squish up and put in your ear, or earmuffs, the kind that go over your ear. You can't go to a gun range without wearing hearing protection, and we know that that's a loud sound. So just kind of attending to and listening to the type of environment that you're in. Oh, you say, it's just the lawnmower. Well, it's just the lawnmower every week for 2 hours each week over 20, 30 years, and that certainly has a compounding effect. Now, I know that a lot of teenagers and young adults don't like to wear ear protection when they go to, or when they used to go to, music concerts and louder venues. But anytime you can feel the music on your chest, you're putting yourself in a dangerous situation. So when you leave those kind of places, when you're young, your ears are ringing, you feel like you have cotton in your ears, you go to sleep, and then you wake up the next morning and everything sounds okay again. But over a long period of time, with repeated exposures to those types of situations, when you wake up in the morning, your ears are still ringing and you still feel like you have cotton in them. You still can't hear very well. And that's when you have, that's the start of changes. That's the start of noise-induced hearing loss. There's a squishy type of earplug that you can buy in the drugstore, in a large store like Target or Walmart. That won't cost you very much money. If you come by our clinic, we'll be happy to give you a free pair of those, and we'll even show you how to put them in. But that goes a long way down the road, because the effect's not going to happen tomorrow. It's not going to happen next week, next month, or even next year. But 10 years from now, when you have the effect of having more birthdays under your belt, as Dr. Gottschalk said, and noise exposure, perhaps from recreational, military, and sometimes occupational exposures, it creates a much more significant effect.
People don't realize that there are little, and I'm making it oversimplistic, little follicles that are inside that are damaged that alter your ability to hear, correct?
Yeah, that's correct. So in your inner ear, which is where hearing starts, you have these little hairs, and they kind of move back and forward like grass blowing in the wind when they're functioning normally. But when they've undergone damage from aging, from noise, sometimes from medications that maybe you don't realize, they kind of get crunched over, and then you're right, they don't work anymore, and we don't have the science yet to regenerate those hairs. And so the only way to treat that kind of issue is with amplification, with hearing aids. But yes, you're correct in that.
And protection, obviously.
Correct.
Dr. Gottschalk, you mentioned children. We're one of the pioneer states to require the testing of newborns at term for hearing. I just wonder how it does get to you for your care.
Yeah. So we actually see a lot of children for follow-up if they were born in the hospital and they are unable to pass their hearing screening in the hospital, then they can come to us for outpatient care. Or even for individuals who were born at home, which we're seeing a lot of now, especially during COVID, is a lot of parents are deciding to deliver at home, and then they can easily come to see us to get that checked off that yes, they had their hearing screened and that they did pass or that they did not pass. If they do not pass, then we do have the equipment here to do further testing to determine whether or not they do have a hearing loss and what type of hearing loss it may be.
Let me just we're down to the last 3 minutes of this show. So Dr. Friedland, let me just tell, and this is not a commercial for NSU College of Audiology or for our clinic, but we have the finest equipment available. So talk to me very quickly about it.
Sure. So we have a full hearing aid dispensary here on campus. We have access to the products from any of the companies out there. There's approximately 8 major manufacturers, and they all feature some things that are a little bit different. Being a university, being a teaching clinic, we have access to all of them because we teach that to our students. So patients coming to us will have a full diagnostic evaluation. They'll be referred for a full hearing aid consult evaluation. We'll talk about their lifestyle. We'll talk about their hearing needs. We'll talk about any other factors that might be involved in their life, in their understanding needs. And then we'll create a plan along with the patient to figure out what would be the best treatment plan and amplification really for them. And we have things in all categories. affordable for all patients. We do accept third-party insurance from several companies, which does reduce some of the cost burden to patients. And, we also have, Dr. Lippman, some over-the-counter products for those individuals with just very mild hearing loss who are just beginning to go through this process. And it's a good way to get something that's very cost-effective, but to ease them into amplification that will probably have to expand to something more custom in the future.
This is not a commercial again for the clinic at Nova Southeastern University, run by the Department of Audiology. But we have qualified individuals. Actually, I said it early in the show, this is a preeminent program, not only in Florida, but in the United States and maybe the world, because we do teach beyond the borders of the United States. So I want everyone to understand that you have a wonderful, wonderful opportunity. I can tell you, members of my own family, I insisted that they be cared for and, shall we say, communicated with relative to their hearing loss. Their problems were mitigated. They live a full, happy life. And these are individuals that go down to age 40 all the way up to age 80. So I want you to know that it does work. This is just a personal reference, which I very rarely say. But thank you, Dr. Friedland. We really appreciate your long-standing, I can't believe how long you have been here, but God bless you. We love you. And we're very, very happy that we have, like I say, one of the preeminent audiology programs in the world, not only in Florida. So thank you very much for your leadership. Thank you very much for your very strong advocacy for good health and good hearing. Thank you.
Thank you, Dr. Lippman. Thanks for having us on today.
And also, Dr. Gottschalk, we're very pleased that you've joined the faculty. And good luck with all of your knowledge and caring. And particularly, as I said to Dr. Friedland, you're a blessing to the community. So hopefully the community takes account of the fact that they have these services available. Thank you both for being here today. Remember, folks, this show is called Dateline Health. I really do this show at your request because your questions come to me. I ask the questions to people like Dr. Friedland and Dr. Gottschalk, and hopefully we gave you your answers. If we didn't, we have an email address and a telephone number right here. Just give us a call and we'll get the questions to them. They'll do whatever they can without causing any harm. And I will tell you candidly that we're very, very proud to have them both here today. Remember, one more time, this little unit called a mask can save your life. It's not a political statement. It's a real scientific judgment statement. It's not Fred Lippman saying it. It's the scientists that are saying it. Take good care of yourself. Protect yourself. We hope that you stay well. And thank you one more time, Dr. Friedland, Dr. Gottschalk. This is Fred Lippman coming to you from Nova Southeastern University. Until next time, see you.